So this morning, as we start phase 3, numbers are down again. We're at about 19. Of those, I think 7 are residents of Spain, so we've got 12 in Gibraltar. Principally, if not all of them, totally asymptomatic, identified in the random frontline testing. So this is not the sort of infection that's going to put pressure on the GHA. Remember, the reasons for locking down, we can see pressure coming onto the GHA. What we need to do is suppress these clusters to ensure that people who might go through the infection in a way that is not asymptomatic, the way that is not mild, do not get it from these asymptomatic individuals. But otherwise, the Cabinet has decided that we can move on to phase 3. We can bring down the posture from major incident and move forward from that, and all the things that were provided for in phase 3 of Unlock the Rock can now happen.
Unlock the Rock document specifies the criteria that needs to be met for each phase of the unlock, and we are now unlocking phase 3. But what about the criteria to relock the rock in the event that cases go up dramatically?
So really, this is a combination of objective and subjective elements, and there are 2 key aspects to a decision to reverse gear. The first that people hear on newscasts from around the world is the rate of infection, the R value, whether that is below 1, whether the infection is taking more people each day in the context of infection, or whether in fact the R is below 1. And here we have an R that is still quite comfortably below 1, and that is the issue that we would be looking at. And the second issue is how many of those manifesting with the virus are in the GHA. If you had more than 20 people coming into the GHA and keeping a GHA bed on a daily basis for more than 5 days, then you'd have 100 by the end of that week. You would then start to see that the pressure was starting to build up on our ability to treat the virus and care for those with the virus. That is the sort of thing that would lead us to once again reverse gear.
As part of Unlock the Rock Phase 3 today, you've closed Linewall Road and some other roads around Gibraltar. In the case of Linewall Road, we've identified this morning that traffic has been flowing freely throughout Linewall Road, so not very much in line with the road closure. Would you say this is poor planning on your part?
This is not poor planning. This is planning to do things properly in a way that is designed to ensure that people understand what is happening and are not penalized or somehow obstructed on the first days of this new process. This is a way of doing things so that people start to realize that what they're doing is now no longer in keeping with the rules, and slowly this will be ramped up, and then there will be more controls, and then there will be penalties, and then we will spread slowly. So all those who say that we've gone too fast on Linewall Road will see that in fact we've planned to do this in a way that makes sure that people do slowly appreciate what is happening and then start to move away. You can't get it right in government. You're told you're doing things too fast and too soon, or you're told that you're doing them too slowly, and you need to consult less and act more. So getting the balance right is what the government does. We think we've got the balance right. People will see that we're going to get to the stage where the road closures are happening seamlessly and in a way that people don't just accept. I think people will appreciate them, and they will really think that the government was right in taking the steps that we've taken.
Public transport is back as from today. How is this happening?
So it's happening by taking the advice of public health to ensure that both our staff, who are the drivers of our buses, and the people who are on board the buses are going to be safe, that we can use the most of the space available, that social distancing inside in buses is obviously complex, so people are going to have to use masks. And we hope that that means that we can have the frequency that we need of our public bus service. I saw some people saying on social media that would introduce charging because they'd misunderstood that we were posting the charges for those who are not entitled to use the buses free of charge. At the moment we think that buses should continue to be free of charge, but those charges will continue to apply to those who are not entitled.
Also part of Unlock Phase 3, the opening of restaurants. Now, you've mentioned today that restaurants will be required to take an individual's name and phone number for a booking. Are there no data protection issues here that you're concerned about, given that most restaurant staff aren't trained in GDPR issues?
So we're not asking that anybody input anything into a computer. We're asking that they write it down in the traditional way when you take reservations in any restaurant. If you want a table at a restaurant, you have to give your name and you have to give your number so that they'll keep it for you. And what we're saying is it's important that that number be kept and shared with the government in the event that there's a contact tracing issue. And we're recommending that people should give the names of all of their party for their own sake, so that if somebody has come near you who has an infection, we can quickly call you and tell you, look, you may have been exposed. You may wish to know. You may wish to be tested at the right time when you've incubated the virus for long enough, if you've had it. So this is not about trying to infringe anybody's rights to privacy. This is about wanting to protect people in the event that they've come into contact with the virus.